Hi, this is Dr. Lawrence Janowski. Today I want to talk about trigger point injections, and specifically trigger point injections for headaches. A trigger point is a knot of muscle. Everyone's felt this at some point in their neck, in their back, their buttock, other parts of their body. There's a knotted muscle that's very tender when you touch it, and that muscle just won't release. And it's really a common cause of pain, even amongst injuries and chronic pain issues that have nothing to do with muscle. For example, people have problems in their spine, but the muscle becomes very spastic and very tight. So we want to reduce that spasm and that pain simply by injecting into that muscle with a small amount of lidocaine, and that's what a trigger point injection is. Lidocaine is very benign, there's no steroid in it, it can be repeated as often as necessary, and often gives people dramatic relief. It can help headaches, neck pain, upper, mid, or lower back pain, buttock pain, sciatic pain, pain in your extremities. So it's a very great way to reduce pain without taking pills. So this is a chart which is kind of an example of different trigger points throughout the body. Trigger points in the trapezius, in the large muscles at the back, trigger points down near the gluteal muscles, trigger points around near the shoulder muscles. So there are many different maps that you can find of these trigger points, but basically you look for them by feeling them, putting a small amount of medicine in there, and then people often get dramatic relief, and it's often repeated over time. So today we have a patient who has some neck pain and some headaches, so we're going to put some trigger point injections into the muscles surrounding the spine. And now I never go into someone's spine, I'm just going to go into the muscles. That's not what I do. And then she has some tenderness in the muscles between her shoulder blades here, as well as the trapezius muscle here. So in a minute I'll show you how we demonstrate the trigger point injection technique. So I'm going to perform some trigger point injections right now. I'm going to use this cold spray called ethyl chloride to numb the skin, and then put a small amount of medicine in each one of these points. Here we go, cold spray, super cold. There you go. Good, good. Great, doing okay?
Yeah.
Let's do the other side. Cold spray. Good. You're doing great. I'm going to do a little on the trapezius. Trapezius. Alright, we're almost there. I'm going to try to get these guys. Is that tender there?
It is.
Yeah. So often you can elicit the tender point just by palpating it. Is one side worse than the other?
My left side is.
The left side,
Mm-hmm.
okay. So we focused on the left side. Alright. Alright, and that's all there is to it. Just a few seconds here, and we'll talk to the patient in a minute. Okay, we just performed trigger point injections on Jessica here for headaches, and how was that experience? Was that painful?
It was painless.
Great. And you know, we don't expect people necessarily to get instant improvement. Some people will say, wow, it feels better right away. Usually I'll tell people within a day or two from the injections they'll start to feel better. Are you feeling anything
Actually,
different?
I don't feel my headache at all anymore. I came in here with a really bad headache, and I was slurring my words, and I don't feel like I have a headache at all anymore.
Okay, good. Well, that's great. I wasn't expecting that. That's a wonderful thing to have your headache relieved so quickly. Doesn't always happen that way. But today we were able to do that. And if the headaches recur, we know, Jessica knows we can repeat this over time. Often for chronic pain conditions, back, neck pain, we do it in a series of injections. And everybody's individual in terms of how often it's needed. But it's very benign. Nothing bad can happen to you from the injection. And it's also covered by insurance. So consider trigger point injections for many different kinds of muscular muscular and musculoskeletal pain, and don't forget about headaches.